You may have heard of it. It's called Bayou Battery, Alabama. It was in the movie Forrest Gump. You saw the movie. And it's a shrimping town. We basically shrimp for a living. And so people work, and they work hard. And so I was in this clinic for a while and seeing patients, and then President Obama asked me to become the United States Surgeon General. It was very hard to leave because being the only doctor in town,
This red is going to red and green is going to green.
So I'm Dr. Regina Benjamin, former United States Surgeon General, and my whole idea is prevention. We want to prevent heart attacks. We want to prevent heart disease. So we want people to stop smoking, have clean air, eat well, exercise, prevent diabetes. But until then, we have to treat people. And one of the things we want to do is make sure they're screened early. And this small EKG machine can go out where they are, can save them days of travel. And if they're not having heart disease, that could save them a trip. But this is taking technology to where people are, and hopefully bring down the price, get it to the masses of people.
See, in India today, heart attack is no more a disease of elite class, or it is a disease of urbanites. It is equally prevalent among the poor people as well as among the villagers. So one of the important aspect of treating heart attack is an early diagnosis and an early treatment. So if you treat heart attack within the first 3 hours of onset of symptom, death rate comes down significantly. So for this, ECG is one of the important investigation to confirm diagnosis. So ECG, to take an ECG and to interpret an ECG, we need a trained person. We need a consultant or a physician or a doctor. So now because of advanced technology, the iMetrics company has come out with a miniaturized ECG. It exactly resembles the size of a mobile phone. With this mobile phone, even a less skilled person, this mobile phone type of ECG or a handheld ECG machine, so even a less skilled person can record an ECG anywhere, either in a clinic or even in smaller hospital, and this ECG can be transferred to a doctor's mobile phone through a cloud system. If diagnosis is confirmed that it is heart attack, treatment can be initiated in their places only, whether it is a small clinic in a village or whether it is a small hospital in a tier 3 cities. As a result, that golden hour is fully benefited to the patient. This reduces death rate and complication rate, and probably we can connect even the smaller hospital with the bigger tertiary care hospital in the city. The treatment can be initiated as early as possible, and also it is useful to confirm whether patient has heart attack or not. Suppose if through this ECG, if it is not heart attack, then we can always console the patient and there won't be any anxiety and fear. Suppose if it is confirmed as heart attack, then treatment can be initiated as early as possible, and initial treatment can be given there itself.
My name is Srikanth Jadchala. I'm the CEO of iMetrics. I live in California, but with an R&D unit in Bangalore. So we have introduced a very revolutionary mobile electrocardiogram technology. What you do with that electrocardiogram detects disease in the heart. Sometimes when you have a heart attack, and sometimes when you don't have heart attack also, many years ahead, you can detect it. Traditionally, you had to come to a hospital, get a chitty from the doctor, and then you have to get the ECG done. And so all this involves one whole day or sometimes 2 days of travel and consultation and everything. Using our device, now even any semi-skilled worker in the villages also can administer it. If they're doing your Aadhaar card registration, if they're doing your ASHA worker, if they're any semi-skilled person in the village, e-kiosk, they can actually run this now. From there, they can send the ECG report to the remote doctor. Then remote doctor will say, look, this is not a heart attack, you are okay. Or this is a heart attack, you please take this medicine from the local doctor or PHC, and you come. then they can also have a preparation for this person. In some cases, especially when in Delhi, All India Institute of Medical Sciences, in the mohalla, when the patient is getting a heart attack, they transport the patient on a motorcycle to the hospital. Continuously, this digital ECG is going to the hospital, right? And they're ready for surgery. As soon as the patient comes, they hand off to surgery. No more testing. That saves, as Dr. Manjunath was saying, every 30 minutes delay, 7% mortality rate goes up. So that saving in time saves the patient, a lot of, it's a life-saving thing basically. So that's how basically our technology is going to impact by saving people a lot of cost in terms of the travel and access to healthcare. By providing, sometimes the rural person is actually getting self-employment now doing the ECGs. That's another economic benefit to the product.